This is Dr. Lund, your Roseville neck and back pain relief chiropractor. 4 tips to help sleeping with sciatic pain. So if you're diagnosed with sciatica and find it difficult to sleep, I'm going to go through my top suggestions for how to sleep better with sciatic pain. But first, let's review some things about sciatica. So sciatica is inflammation or irritation of the sciatic nerve. This is a nerve that forms by the nerves that come out of your lower back. The nerve travels all the way from your lower back to your foot. And so someone with sciatica can experience pain throughout the entire leg to the foot or just parts of the leg. And those symptoms can be variable. They can be pain, they can be tightness, it can be burning, it can be numbness and tingling. But one of the key things is that sciatica is often misdiagnosed, so it's really important to see a practitioner who specializes in back problems to ensure that you have the correct diagnosis. So let's go through the 4 tips to help you be able to sleep better with sciatic pain. So tip number 1 is sleeping position. A 2019 study of people with herniated discs and sciatica had more pain when lying on their backs with their legs straight compared to lying with their knees bent. And so when the knees are bent and the hips are bent, it takes tension off the sciatic nerve. So what you want to do is you can use pillows, blankets to basically elevate your knees, but then also elevate your feet, as that's going to then also elevate the hips. Okay, so again, put something underneath the knees and the feet. You'll elevate both the knees and the hips. That takes that tension off the sciatic nerve. Okay, you want to avoid sleeping on your stomach if you have sciatic pain or low back pain, because stomach sleeping puts more pressure on the joints and the sciatic nerve, causing more pain. So what about side sleepers? Okay, so this is where it gets a little bit more complex. So if you have a disc herniation on your right side and you have sciatica on your right side, then laying on your left side can take pressure off the sciatic nerve, but that's only if the mattress is firm enough. If you have a disc herniation again on the right side and sciatica on the right side, and you lay on your left side and your mattress is too soft, then your body tends to sink into the mattress and it pinches that sciatic nerve. So you would have to test that to see if side sleeping, but generally if your sciatica is on the right, the side that would provide you relief would be on your left, assuming that your mattress is firm enough. But bottom line is that you want to keep the spine in the best alignment to keep pressure off the sciatic nerve. And sleeping on your back with both your knees and your feet elevated is the best approach. Tip number 2, reduce inflammation. In my experience, an ice pack on the lower back is the best way to get temporary relief. So you want to ice for 20 minutes and do that a few times per day, putting that ice pack right on the center of your lower back. Many patients are tempted to use heat because it feels good, but what heat can do is increase inflammation, making the pain worse hours later the next day, and then you don't equate it to heat and you think, oh, it's hurting again, I'm going to heat it again. So tip number 2, ice and stick to ice. Tip number 3 is muscle relaxation. So magnesium is a mineral that's very important for making the nerves work properly and to help the muscles to relax. So you can do one of 2 things. You can take an oral supplement of magnesium, or another option you have is to take an Epsom salt bath. Basically, you put the magnesium in the water, and that can also be very helpful for reducing or improving muscle relaxation. And then tip number 4, there's a lot of research that supports that chiropractic adjustments are helpful for both acute and chronic sciatic pain relief. It's what I do for my patients that come in with low back pain and sciatic pain. This also helps improve sleep after the adjustment because people have less pain and they feel better. So let's recap my top 4 tips for how to sleep better with sciatic pain. Number 1, sleep position. Sleep on your back with both your knees and your feet elevated using pillows or blankets. Tip number 2 was use ice to reduce inflammation. Tip 3 was to take magnesium or do an Epsom salt bath to help with muscle relaxation. And then 4 was spinal adjustments to decompress the spinal joints, relieving the pressure in the discs and on the sciatic nerve. So if you're suffering with low back pain or sciatic pain, give me a call. My goal is to get you out of pain as quickly as possible. I don't give any lengthy treatment plans that last many weeks or months. I see patients Monday through Thursday, 8 a.m. to 6 p.m. I provide same-day appointments and same-day treatment. So if you want to be treated today, call me at 651-779-5998. Thanks for watching. This is Dr. Eric Lund, your Roseville neck and back pain relief chiropractor.